Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony.
Thank you very much for having me once again.
All right. Let's talk about Region 1. What is happening? What is the latest coming out of Region?
Well, Region 1, as you know, we have lockdown in Quebana, and that is continuing. And the health team that is stationed there, we are continuing to do both sanitization of residents um, and also making sure that the persons who have tested positive are properly isolated. We have moved a team there for the duration of the lockdown, so they're going to continue to monitor the activities of the residents in Quebana, and if they need any additional medical assistance, they would be provided with that.
Do we have a figure as to how many persons are
Currently, we have about 61 active cases in Quebana. I think for the whole of Region 1, we have about 92 cases or so. So Quebana makes up the bulk of those cases that we currently have in Region 1. And that is why we're paying so much attention to um, Quebana.
And in terms of the medical team itself, how are they operating? Have you gotten specific reports from them? In terms of themselves, how are they functioning?
I think they're functioning well. They're not new to this. They have been doing this for a while now because they were involved in the lockdown at Maruka. They were involved in other areas where we had spikes in cases. So I think they're doing well.
All right, and they are getting assistance in terms of transport throughout the week because I know it's
Yeah.
stretched out.
We collaborate very closely with the region, and the region has been providing all the assistance that we need. And in cases where they need extra supplies, we are providing that from Georgetown.
All right, as we're talking about lockdown from one region, let's address the measures. They will be expired soon, and of course, what's going to happen from the first?
Well, the measures would pretty much be similar to what we have now. There would be a few adjustments that we are making. A number of stakeholders would have met at various times during the past month with the task force. They have brought to our attention a number of areas that they think we should change, and we have listened to those suggestions. We have done some assessments, and we'll see based on our assessments whether we can allow for changes that they are requesting. So the grouping that deals with the guidelines have met, had their preliminary meeting, and we are working now to finalize those guidelines. So we are hoping that by Friday, that job would be completed, and we'll be able to gazette new guidelines by Friday to come into effect on Sunday.
All right, thank you. Minister, what about training? I know the ministry has continued its training of health officials and so on throughout this period. The first one was the mental health, and that was followed by the training for doctors in collaboration with the government of Chile. And there is a new training that is supposed to occur soon.
Yeah, so training is one of the things that we are continuously doing. Uh, so we had training that is training that is currently ongoing on mental health, and that is to ensure that our primary health care workers understand how to deal with issues of mental health, to be able to identify, to be able to give preliminary treatments, and if possible, if needed, to refer those patients to more specialized care. So that's an ongoing exercise, and we're also teaching our primary healthcare workers to do counseling, because a lot of times, sometimes we don't pay the kind of attention to counseling that we need to pay. So that's one area. We have been running some in-house training for persons to be able to use ventilators, and that has been an ongoing training. We're doing it in a hybrid format where they're doing a lot of the theoretical parts online, and then they'll do some practical training on the ventilators themselves. So that's an initiative that is being run by the Georgetown Public Hospital Corporation. The third set of training that we are working on is with the government of Chile, and they are going to be running an online training starting from the 2nd of November and would go until the 20th of November. And this training would deal basically with the management of severe and critically ill COVID-19 patients. So we are doing this training locally in collaboration with the Medical Council of Guyana. So I'm sure that the doctors who would be involved in the training, it's free to everybody. They can register, and I'm sure that the Medical Council of Guyana would accredit that training. Then there's a fourth set of training that we are going to be rolling out in November, and that is with the assistance of the U.S. government. We have a number of U.S. Physicians who would be in Guyana in November, by the second week of November, and they would be going out with our local team to a number of regional hospitals and conduct at those regional hospitals training on site. So we expect that that exercise would last maybe for a week, going to different regional hospitals. Our main aim is to provide that kind of training to the doctors and other health workers at the hinterland areas. So we're looking at Region 1, 7, 8, and 9. We'll do some other regions on the coastline, but our primary focus would be the hinterland communities.
All right, and as we wrap up, just a bit of information. The weekend is coming up. I know Operation COVID Curve is on. Anything specific planned?
Well, as usual, we'll have teams of persons going out to different communities, talking to people, helping with the education, sharing out the leaflets, and so forth. And in cases where people are not wearing masks, to try to give them a few masks. So this is an ongoing exercise, and I think by and large, as we do more of this, we are seeing more and more people complying with mask wearing and keeping their social distance and so forth. So it would be an ongoing exercise, and we like more leaders in the community to become part of the exercise. You don't even have to wait until Operation COVID Curve comes to your community. You can initiate your own type of operation, if you like, by, you know, talking to your neighbors, informing them, talking to people around you, talking to your friends about the importance of wearing a mask and keeping your distance and so forth. I think once we start, each one of us, keep reminding other people about what we need to do, and we ourselves complying with these regulations, then we are setting a good example. And I think once we multiply that effort, then we'll see a big change and a drop in the numbers of cases that we're currently having. So I just want to urge people to keep working at this. I know it sounds very fatiguing, and sometimes people are tired that we're telling them the same thing over and over and over again. But it's the nature of what we have to do. It's better that we use simple techniques to prevent the disease rather than we end up in the hospital and then we are regretting that we didn't wear a mask.
I'm going to suggest lastly, I know you lectured on epidemiology, that's the correct word. So you have how it spreads. And so when you advise, you're advising from a place of knowledge. So we want to say thank you for accommodating us again today. Do you have any last words that you may want to say?
Well, tomorrow our Muslim brothers and sisters are celebrating Yom Nabi, and I just want to use the occasion to wish them a happy Yom Nabi. And I'm sure that whether they celebrate at home or they celebrate in the mosque across our country, that they will uh, take into consideration the special circumstances in which we are operating now, and they would heed all the ministry's guidelines to stay safe and away from COVID. So I just want to wish everyone a happy Yom Nabi.
That's it for today's COVID-19 update. We've just spoken with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and of course the ministry's website as well, health.gov.gy, and our social media platforms.